All right, hello everyone. Thank you so much for tuning into our webinar, Finding Your Why for Total Worker Health. We're going to go ahead and get started. This is the HealthLinks 2019 webinar series. I first wanted to start off by telling you a little bit about us. First of all, my name is Katie Guthmiller. I'm the program coordinator here at HealthLinks. And for those of you who aren't already in our network, I did want to just tell you a little bit about who we are and what we do. So HealthLinks is a mentoring program that champions health and safety at work. We offer evidence-based healthy workplace certification and advising to help organizations achieve total worker health. We are a nonprofit based in the Center for Health, Work, and Environment at the Colorado School of Public Health. For those of you who are in our HealthLinks network, you may be familiar with our benchmarks. These are the different areas where we assess and advise in HealthLinks. And I did just want to highlight that today for our objective of setting annual objectives for total worker health, we are focusing on the health programs and policies benchmark. Just some general housekeeping while we're getting started. Just so you know, all participants will be kept on mute throughout the duration of the presentation. Please use the chat function for any technical issues. If you have a question for either our speaker or our panelists, please use the Q&A box. So again, technical issues, use the chat function, and questions for our speakers and panelists, use the Q&A. So you are aware the webinar is being recorded. I will be uploading this to YouTube once we are done, and I will send you all the links so you can revisit this. I also encourage you to check out our HealthLinks YouTube page where you can look at all of our previous webinars as well if you're interested in that. There will be a survey or a link to a survey at the end of this webinar. It's very short. I encourage you to take just a minute or two to complete this. It helps to inform any changes we want to make to our webinar series in the future. And hopefully you all know, but Sherman Ches credits are available for this, and I will be providing more information in the follow-up email. All right, about our speakers for today. So unfortunately, Dr. Lee Newman couldn't be with us in person, but we do have a recorded intro from him that we'll hear in a second. Dr. Newman is a researcher, physician, public health practitioner, and educator. He is a distinguished professor in the Departments of Environmental and Occupational Health and Epidemiology at the Colorado School of Public Health. He is founding director of both the Center for Health, Work, and Environment and the Mountain and Plains Education and Research Center. He co-founded HealthLinks and the Colorado SPH Certificate in Total Worker Health. Dr. Newman consults for government agencies, multinational corporations, small and medium-sized enterprises, labor groups, and community organizations. His favorite life role is as mentor, second only to husband and father, and he is irrationally optimistic. Our speaker today is David Shapiro. David is the program manager at HealthLinks. In this role, he consults with organizations in the HealthLinks Healthy Business Network, sharing resources and recommendations to help them improve the health and safety of their teams. David is a proud husband and father of 3, and lifelong learner and relationship builder. His hobbies include tennis, hiking, reading, and gardening. All right, so we will go ahead and kick things off with our intro from Dr. Newman.
When you're setting your annual objectives for total worker health, the starting point is to consider what are our core values. You want to know why you're doing what you're planning to do. And there are several reasons why you want to be establishing those core values. First of all, you know that your business has a certain mission. You have a vision of where you're trying to take your business. You know that your employees are the most important key to the success of the entire enterprise. So if you take a moment and say, okay, what are our business's core values? And what are our employees' values? And how do those two align? You then have an opportunity to get really the golden fit. And the golden fit is when you are able to articulate to your team why we're doing total worker health, and tie it back to what they find meaningful and what you as a business leader find meaningful. When that happens, you find that you'll have higher engagement. You'll have people who understand why health and well-being is important for them to be successful as individuals, as well as lead the business itself to be more successful. You'll have a shared understanding that the sustainability of the enterprise starts with knowing why you're doing what you're doing, and why you're investing the time and effort to promote well-being across your organization through total mental health. The example that I would use is I can think of a healthcare organization which was doing great stuff. They had lots of different activities. They were setting SMART goals around them. They were evaluating whether there was engagement, participation. But at the end of the day, they were putting a lot of effort into it without a real message coming back to the rest of the organization or even to their own group as to why they were doing it and why some things were important to do. When they found that message, when they aligned the values of the workforce with their overall corporate values, they had a more robust program. They were able to boost engagement and participation in the various kinds of activities that they scheduled for the year. And now they have just an incredibly powerful message from the very top of their organization all the way through the entire organization around total worker health and the promotion of health and well-being as a pathway to promoting the success of their healthcare system for the benefit of their patients. It's a great example because we sometimes forget that we have to make sure that we're aligning our own personal values, talking about those values, and folding those into the bigger picture of what we as a business are trying to achieve for the benefit of our customers and clients. So as you're setting your annual objectives, please remember to start with a consideration of what are the overall business strategies and values that we have. Discuss those objectives with your colleagues, your coworkers, your leadership team, and take the opportunities to articulate that, share it back, and use it as the starting point for setting your more specific goals for the year. You'll build culture, and you'll also have greater achievement.
Okay, great. Thank you, Dr. Newman. I will now hand things off to David Shapiro.
Hi, Katie. Thank you, team, for joining us today. Thank you for all the participants. I'm David Shapiro. I'm the program manager for HealthLinks. Just going to call up my presentation. Really happy to have all of you joining us today to speak about finding your why for total worker health. As Lee mentioned, understanding your organization's core values is the first really key step to finding your why for total worker health and for setting annual objectives for your program. Generally, leadership sets an organization's core values at the top, and hopefully they do a good job explaining it to everyone that is in the organization. If you're making the case for an annual budget for your total worker health program, it's really a good idea to make sure you connect your objectives to the overall values of your organization. Because when leaders see the connection, they can move from a conversation of, well, we know this is really the right thing to do, but do we have the budget for it? To this is what we do as an employer because it aligns with our core values. In a moment, we'll talk about the next action step, which is being data-driven. But first, I just want to explain the reason behind our presentation today. Here's what we're seeing. Nearly every employer in our Healthy Workplace Network indicates that they offer some health programs and policies. This is across the board to promote worker health and safety, whether they be tobacco or nicotine control, mental health, physical activity, stress management, family-friendly workplace policies and practices, or disease prevention. The first question in the health programs and policies benchmark, however, is, does your organization set annual objectives for total worker health? Now, when organizations take our Healthy Workplace Assessment for the first time, nearly 40%, over 1/3 of the respondents answer no to this question, even while they're offering a whole menu of health programs and policies. So we have to ask ourselves, what's going on here? And what can we do to help? Sometimes an organization has launched into health and safety without really establishing clear objectives about what they're doing and why they're doing it. And other times, organizations have been offering activities for many years and they're kind of operating on autopilot, where they're offering the activities, but they're not sure why or how to measure success. It's just something they've always done. So there's a clear trend for employers to achieve total worker health, both for their organization and for their employees. And what we know is that setting SMART goals or setting annual objectives for the total worker health program builds a case for long-term sustainability and success. So let's return to our conversation on how to set annual objectives. Once you've taken the time to understand your organization's core values, it's time to access some data in whatever form you can. It's difficult to set realistic objectives that make sense for your organization without first knowing what's going on. Employers in our Healthy Workplace Network access a variety of data sets. Some can get aggregated healthcare claims and costs to provide key information which inform the health and safety activities. So knowing more about employee health and well-being can help you set goals that are relevant to the needs and interests of your team. Workers' compensation insurance can also provide relevant data about safety-related claims and costs, the causes for injuries and illnesses at your workplace. And things like physical worksite assessments can help you learn more about the worksite itself and the surroundings and help prevent future injuries and illnesses. Another important metric to have are sign-in sheets and the number of times individuals log in to your wellness apps or portals or websites. This can help you understand how many people are participating in your health and safety programs. And finally, or well, not finally, but another piece of information that's really important are satisfaction surveys. Even if it's just a quick check-in at the end of a program offering, finding out what the employee perceptions are of the activity is really important. It can help you improve future programming, decide if it's something you want to move forward with, and if the activity was relevant and meaningful to your team. So one thing we want to acknowledge is we know that all of you may not have access to this data. Small employers, we continuously hear that it's hard to get even aggregated healthcare claims and costs information from providers, from insurance brokers. So the theme here is, what can you get? Whatever you can get information-wise can help you be more informed, and it can help build out your objectives so that they really do meet the needs and interests of your teams, understanding that you may not be able to get everything. Let's take a few minutes to talk about SMART goals and how to set them up and why they're important. But before we explain SMART goals, we want to take a quick poll and find out how many of you are using SMART goals. So the question here is, does your organization use SMART goals? You can either respond that you're using SMART goals in general, or if you have a total worker health or a workplace health and safety program, are using SMART goals for that program or those activities. We'll take a moment to let you respond before we talk a little bit more about SMART goals and why they're important. Now, we know we didn't give the explanation first, so if you know what SMART means and you're using SMART goals, please respond or give us an answer to the first poll here.
All right, looks like most people have responded. I will go ahead and share the results.
Great, thanks, Katie. So almost 60% of you are using SMART goals, which is terrific. We're hoping that when in our Q&A session, our dialogue coming up later today, maybe you could give us some examples of the ways that you're setting SMART goals, or you may find out as we go through the presentation that maybe the goals are not meeting the definition of SMART. So whatever you find out, just make sure that as you think about Q&A at the end of the session, either for myself or the panelists, that you share us a little bit about how you're using SMART goals. So what are SMART goals? So a goal, as you probably know, is a statement about a desired future that you wish to achieve or you want to achieve. It describes what your organization is trying to accomplish. Goals serve as a source of motivation and commitment, and they provide a guide to action, as well as a means to measuring performance. They help develop a common understanding of where you're going, and they help you get to where you want to go. In the SMART model, defined here on your screen, goals are written simplistically, and they clearly define what it is you're going to do. So for specific, this is the what, the why, and the how of the objective. A goal is specific when it's focused and provides a description of what needs to be accomplished. A specific goal is clear, and it has to be easily understood by everyone involved. Some questions you might ask are, who's going to be involved? What's going to be accomplished, and when is it going to get done? That'll relate to time bound, the last of the SMART acronym. A measurable goal is one that provides tangible evidence for how the goal can be accomplished. It's important to gather baseline data and to have a target. A measurable goal might answer questions like how much of something, how many times, and how you'll know it's accomplished, how you'll know when it's accomplished. Achievable goals, we encourage you to think about what achievement means at your organization. So an achievable goal is one that's well defined so that you can actually achieve it, and it might stretch your comfort level a little bit so that you feel challenged. We know that when there's a little bit of a challenging element to setting your SMART goal, people strive to achieve it a little bit more. So setting achievable goals really requires a good working knowledge, which can be informed by knowing the core values of your organization and being data-driven. And leadership needs to agree at your place of work that the goal is important and that they are able to dedicate appropriate time and resources to focus on achieving it. A results-focused goal measures an outcome, not an activity or an output. And a time-bound goal, as we mentioned earlier, it has a starting point and an end point. So there's a lot of reasons why SMART goals are important, and we'll hear from our fellow panelists today about how they're using SMART goals and why they're important to them. But a few key metrics are listed on your screen here. They measure success, they keep expectations real and realistic. You can revisit them over time, and they generally and hopefully align with your company's goals. So SMART goals help keep your program on track. They allow you to measure success and adjust if you're unable to meet the expectations of the goal. We want to mention here that evaluating your program annually is really important to keeping the activities relevant, to keep employees engaged, and to help keep you make continuous improvement. We don't want things to become static. That's generally when we see engagement lessen, and we want to make sure that employees are participating, that they feel engaged, and that the health and safety activities are meeting their needs. We're going to share a real basic example of a SMART goal. So the first thing to consider when building your SMART goal, and as we review the example here on the screen, is does it align with the goals of your total worker health program or for your workplace health and safety program? So this is an example, but what we want to begin have you thinking about is, do I know my organization's core values? When I'm setting the SMART goal, can I think of something that really aligns with my organization's core values? That's the first step. So once again, here's a really basic and easy to understand SMART goal. By March 3rd of 2020, the Happy Company will have at least 50% of its employees complete health screenings. So how is this SMART? The goal is certainly specific. It indicates what employees are going to do. They're going to complete health screenings. Now, this is a goal. Getting employees to participate in health screenings is something that we've seen quite a bit in the Healthy Workplace Network as a goal for health and safety programs. The entire goal itself is measurable. Here, the Happy Company is measuring how many employees might participate in health screenings, which is at least 50%. Also, the goal is time-bound. It sets a specific date. And in this case, in the example, it's by March 3rd of 2020. So specific, measurable, and time-bound we're talking about here. Let's take a little bit of a closer look at achievable and results-focused. These are a little bit more complicated. They're both relative, and they're dependent on your organization and what goals you have in mind. Things that the Happy Company needs to consider in terms of achievable and results-focused are how many employees maybe work there and how many times they're going to offer the health screening. When we think about achievable, this is really important to partner with leadership because we need to discuss what achievable means at your place of work. Achievable depends on what you have going on throughout the year. As I mentioned, how many employees you have, where and how they work, and several other, several other factors. So in the case of this example, the happy company might consider how many employees. Are we talking about thousands of employees, 10 employees, and what the percentage is going to be of having them participate. Also, how many times throughout the year they can offer the health screenings, and in what locations, depending on where people work. This is how you determine the achievability of your goal. And finally, addressing the barriers to access and making the experience as easy as possible are ways to increase the percentage of employees that participate. So depending on what the happy company finds or talks about amongst their team, they could set a goal of 10% or 80% of their employees. Ultimately, you and your team know what's best when it comes to working in your organization and building achievable goals. Let's compare these two examples again and talk more about these two examples, which are a little bit different, and talk a little bit more about establishing results-focused goals. We frequently see goals, we frequently see goals that meet the criteria for a lot of the SMART acronym, but not necessarily all of it. So option B here is specific, it's measurable, it's achievable, and time-bound. But option A adds results-focused. It addresses what the happy company is trying to achieve. So simply providing the screenings, as option B indicates, which sometimes we see a lot in our network also, organizations say we're going to have a goal of offering a certain number of health screenings per year. And maybe we're going to accomplish it by a certain date and time. So that is time-bound. It's specific. You're offering health screenings. It is measurable, and it may be achievable, but it's not results focused because you're not setting an intention or a goal of how many employees are going to participate. What we know is when employees participate, in this example, in health screenings, they're more likely to choose a primary care provider, learn about their overall health, and take steps to improve. These are all examples of additional results-focused benefits. One other note here, I just want to pause to talk a little bit about results-focused goals. We hear from a lot of organizations in our network that they've established a goal of reducing the number of employees experiencing a certain condition, whether that be stress or hypertension, obesity or diabetes. And sometimes these goals are directly linked to rising healthcare claims and costs, and that makes sense. We understand how that can come about. So these types of results-focused goals do make sense, and we understand them. And we want to offer a couple alternatives to them as well for you to consider. So if you have data about your employees and you know that a certain percentage are experiencing a certain condition, as I mentioned, hypertension, diabetes, you could set that percentage as your baseline and work to ensure that that percentage does not increase year over year. That's another way to establish a results-focused goal. And the reason being is that ultimately individuals are responsible for their own behaviors and setting their own individual health goals. An employer can benefit from establishing this threshold or baseline, like knowing what percentage of employees experience diabetes or hypertension and working to ensure it doesn't increase. And at the same time, that employer can offer activities and programming to individuals to help them manage that condition and help others from preventing it to occur. So while we see a number of goals of we want a certain number of employees to reduce a certain behavior, certainly a valid goal, important, very important from a public health and a workplace safety standpoint, obviously tied in with healthcare and workers' comp claims and costs. Another thing to consider is we know that this certain percentage of employees experiences this. We want to make sure that doesn't rise over time, while at the same time offering activities to help the employees that are experiencing the condition reduce it. So just another way to consider that goal. So we have another poll here as we do a little bit of a learning check-in on SMART goals. Appreciate all of you staying with me today. And now we're going to check in a little bit on what you've learned about SMART goals before we move on to talk on with our panel. So the question here is, which aspect of the SMART acronym is this goal missing? Now you can only choose one. So the question here is a little bit different than our original goal. By June 2020, employees at the happy company will be happier. So I'll give you a few minutes to figure out what you think is the what's missing from this goal. And as I mentioned, there could be a number of things missing, but we're going to pick up on one.
All right, looks like responses are slowing down a little bit, so I will go ahead and end that and share the results.
Great. And we've got one on the Q&A for measurable as well. So I like how people are thinking about this. Obviously, there's a number of responses. We were also thinking and going for measurable as what's missing from this particular SMART goal. So it is specific, right? The who and the what is listed here. Achievability, as we mentioned, depends on the organization. Now, while the results, being happier, may be vague, there is a result listed in this goal. A way to add measurement to a goal like this is by June 2020, employees at the happy company will be happier as measured by our annual employee engagement survey and whatever specific questions you have about employee well-being at work, or maybe even if employees are pleased or would recommend their workplace to others. So the way to add measurement into this goal is to have a specific measurement tool. How are you going to measure that employees at the happy company will actually be happier? So measurement was what we were going for there. So that wraps up my brief discussion on SMART goals, setting annual objectives. I'm happy to answer any questions through the Q&A process, but for now, I want to introduce our panelists today. We have some great individuals and organizations represented from our Healthy Workplace Network. Ashley and Sherry are joining us today from White Construction Group. White Construction Group has been certified by HealthLinks in our Healthy Workplace Assessment for 4 years in a row, and they've moved from Healthy Workplace Partner into the Healthy Workplace Leader category in 2019. Thank you, Ashley and Sherry, for joining us. We have Kaylin and Marissa, who work at National Environmental Health Association, and this organization has been certified for the last 3 years and actually received some accelerator funding from our HealthLinks in 2016. So once again, so thank you to Kaylin and Marissa, Ashley and Sherry for joining us today. We are excited to have you share your experiences about finding your why for total worker health and setting annual objectives for your health and safety program.
All right, thank you so much, David. We will go ahead and get started with the panel discussion. I just wanted to remind everyone, if you have questions for David or for our panelists, please use the Q&A function at the bottom of your screen. We will be addressing questions at the end, so make sure you put those there. All right, thank you panelists for being here today. If you could please start by introducing yourselves and just telling us a little bit more about your organization and what you do to achieve total worker health. We'll go ahead and start with Neha.
All right. Hello, everyone. So my name is Marissa, and I'm joined by my colleague, Kaylin. Her box may say she's also Marissa, but she is, in fact, Kaylin. We do work for the National Environmental Health Association. We are a nonprofit professional association for environmental health professionals. We currently have over, I believe, 6,000 members, and they typically work in government, local, state, federal, academia, as well as industry. We have some industry members, thinking like Starbucks or Red Robin. Some of your big chains do employ environmental health professionals. And so through grant and membership support, we work with a lot of federal partners like the CDC, the Food and Drug Administration, and the Environmental Protection Agency on a lot of issues such as climate change, food safety, water quality, preparedness, and many, many more. As David mentioned, we did receive some funding in 2016. So since then, to kind of support total worker health, we did develop an employee-led wellness committee back in 2016 that really helps support and guide our wellness program, which we also developed in 2016. We have, I think for a few years now, been distributing an annual survey, which is our way of sort of collecting information and feedback from our staff about what their wellness needs are for that year, how they're enjoying the programs we've been putting on, how they're using them. And we've also created what's called a Wellness Day benefit, and this is basically a vacation day, an extra vacation day, if you complete, I think, 4 out of 7 sort of wellness activities, and these are things like getting a flu shot, going to see your primary care or your dentist. So we're really just trying to incentivize things that we think people are already doing and healthy behaviors. And then the last thing we've done is we've really started to hold volunteer activities, at least on an annual basis, to really facilitate what we call social wellness and just kind of connect us with our community and with each other in a different way. So that's kind of what we've done over the past few years to kind of create total worker health.
That sounds great. Sounds like you guys are doing a lot of really cool things.
Definitely.
All right, White Construction Group.
Yeah, so I'm Ashley Valenzuela. I'm the Director of Human Resources for White Construction Group. I have Sherry Byer here with me. She's one of our staff accountants and one of our wellness champions. So similar to Marissa, we also have an employee-led wellness program. We've had a history of wellness kind of themes woven throughout our strategy at White Construction Group. We've been in business about 35 years. We're a commercial general contractor, so we work all over the state. But we never had like a formalized strategy. So one of our goals probably about 3 years ago was to really develop a wellness platform that was going to bring wellness to our job sites, that was going to allow employee participation from, the bottom of the organization all the way to the top. And with that came a lot of data analytics that really helped inform our wellness strategy. So we thought a key component of that was employee voices. So I really joke and say I'm just the workhorse behind all the compliance pieces, and it's really my employees that set the strategy and direction. So when it comes to total worker health, we cover everything from suicide prevention and mental health in the workplace to weight loss strategies. We even added what we call a novel idea. So it's a new program for this year, and it has a reading and education component. And so Sherry and I kind of came up with this concept, and the idea is that we're going to take these different themes, these different educational threads that we've woven over the past 3 or 4 years, and really start building key curriculum and competencies around the way that we teach and train our employees about wellness. In construction, it's kind of a unique animal. Our population, 9% of the industry is female, so the remaining percentage is male. And I think sometimes wellness has a stigma. It's kind of what I joke as a concept of it's a woman in yoga pants, glowing, not sweating. So it's just not relatable. So our challenge was really to figure out how we were going to get wellness to be a relatable activity, and to 1, bring it to our job sites, and then 2, make it very relevant to our workforce. So earlier in this webinar, we talked about workforce alignment and values and strategy. So that's really been our focus.
That's great. I love that you're really making it personalized to the people that you work with, and the fact that you're tackling intellectual wellness. That's really neat as well. I don't know too many organizations who are doing that, so that's great. Next question I have for you all is, how does total worker health relate to your organization's core values? And we can stick with you, White Construction Group.
Sure. So we always talk about building community, and sometimes people look at me a little funny and say, well, what is that? And I like to describe it as we like to leave people and places and spaces better off than when we found them or came in contact with them. So wellness can often be thought of as it's the right thing to do, but there's also real ROI. So I talked about strategic alignment. I really focus on wellness outcomes such as retention. So how do we sell it in onboarding? How does it attract new hires? Sherry's a testament to that. One of the things she really liked about our package was the fact that we had a wellness program. We look at less workplace injuries, decreased absenteeism. So all of those hard return on investment statistics. But then we also look at, okay, now it's also the right thing to do. So how can we align that externally with our community stakeholders? So I'm pretty proud of our program. We focus both internally and externally. We've partnered with organizations like the Crisis Center to offer leadership and communication development and professional training for our employees. They specialize in domestic violence for the Douglas County area. We've partnered with the American Heart Association, the Chamber of Commerce, the list goes on. So for us, we look at ways to support business missions, our external stakeholders, while also aligning that to our core value of building community. We believe that healthy employees are more productive, and then they're more inspired, which is one of our values, to go out into the community and do SMART, so intelligent, which is another value, inspired work that then will inspire other people to engage with us and follow suit and hopefully go out and make the world a better place.
That's great. You definitely should be proud of your program. It's a great one. National Environmental Health Association?
Yeah, so we're actually working currently to develop our core values. We really hope that by increasing senior leadership support, that'll be one of the ways that we can actually integrate total worker health into our organization's core values. We're currently at the point where we really think that just having a wellness program is a great first step in the right direction.
Yeah, you're definitely right. That is a great first step. And like David mentioned, it's pretty essential to have that leadership buy-in. So it's great to hear that that's the direction you guys are taking. How do you go about goal setting? And we'll stay with you.
Yeah, so we really have to recognize our limitations up front. We think that that's really the most important first step, because otherwise you can get bogged down, whether that's looking at the support of senior leadership or small budget, maybe having a hybrid office of remote employees. Whatever it is, you really need to then set realistic goals based on those limitations, because otherwise you're going to shoot for the moon and you might end up in the stars. So to help with this process, we actually distributed an annual staff survey to help guide our committee's efforts and what initiatives we wanted to have for the fiscal year. And based on the responses from the survey, the committee was able to work together to create our annual goals for the year. We're actually hosting a lunch and learn next week, and we're actually going to be able to present the survey results to the staff as well as our annual goals. So again, one of the important things for us is actually transparency and working together not only with the committee, but also with our staff to bring them a program that they want and to set goals that they want to help us to achieve, because their participation is how we're going to be successful.
That's great. And I love that you brought up presenting the survey results back to the employees. I think typically it's really easy for us to roll out all these surveys and then just kind of keep all the data internal and use it to inform our programs, which is great, but it's that added step of reporting back to them, making them feel like they're involved and their responses are being heard, and that you're going to do something with that. So that's great. All right, White Construction Group, how do you go about goal setting?
Yeah, so I would say that our goal setting process has definitely evolved and become more sophisticated. I mentioned that we had some themes of wellness throughout our history long before I worked for the company. So what I wanted to do is really pay homage to that legacy and build off of those themes so we could build on the culture and just continue to improve upon it, not necessarily replace it or change it, but just really bring all of those people with us rather than drag them behind us. So what I did is I did a lot of baseline testing, a lot of base research and scores, and then every year we built upon that. So some examples of things that we use are stay interviews. So every 90 days after we hire a new hire, they sit down with me and we do a stay interview. And then we talk about wellness, we talk about what's going well. So that's one metric. I also use exit interviews, which has a wellness component to it. And so I asked them, what did you think about our wellness programming? What about our benefits, work-life balance, all of that stuff? And so there's some very hard data that then I can get and gather across the organization. We rely on a lot of the tools from HealthLinks. So we do have like the family-friendly report card that we utilize, the healthy business leader report card. We do have a wellness platform. We use WellRight. And so since we're like a mid-sized company, it's a nice, flexible, affordable option for us. And it gives me data analytics on how employees use the portal, how often they use it, how many program completers, what activities are most popular. And then, of course, we use some of the basic stuff like an employee survey. So every year we also do an annual survey asking employees, what themes would you like to see for the next year? What did you like, not like? How can we improve? And the way I share those results is I'm super transparent. I always joke and say, what you see is what you get with me, good, bad, ugly. So when we first started really enhancing the program, we did get some feedback that was like, this isn't working. And so the best thing I think we did was be very transparent, both with senior leadership and also wellness champions and employees in general, about what that looked like. because that helped us gather buy-in, it helped us have honest discussions, and it helped us fix things that weren't working and also build on those things that employees were really enjoying and were helping us make progress across the organization.
Mm-hmm. That's great, and it's good to hear that, well, maybe not good to hear, but everyone has some barriers and challenges along the way, so it's good to hear that you're able to work through those. National Environmental Health Association, what sort of barriers or challenges have you faced when you go about goal setting?
I think, one of the things is kind of a simple challenge, but it's still been a challenge, is getting employees to take our surveys. Our IT manager likes to send surveys as well, and we have a few other departments that are try to solicit staff feedback. So it tends to get like survey fatigue. So we just explored fun ways to try to get from, the simple of like gift cards to, lunch with the executive director, and just different ways that might get people more engaged with our surveys. And then I think, Kaylin mentioned earlier that we are a hybrid office. So we are headquartered here in Denver, Colorado, but we have a growing staff in the Washington, D.C. area, which is, if anyone's familiar with that area, it's like, they could live in Maryland or Virginia, but still kind of be working out of Washington, D.C. So, how do we develop inclusive programs and activities, particularly our volunteer activities, which are this group thing that we do? That's a big challenge for us, and we expect that staff to grow in DC, so we expect this to continue to be a challenge for our wellness program. And then, we set a goal. I mentioned earlier that we have this Wellness Day benefit, and we were finding that very few staff were participating. And I like, what Ashley said about the stay interviews and engaging folks about wellness. I never even thought to do that. I think that's a brilliant idea. But, we set a goal to try to improve participation in that Wellness Day benefit through more just like education and awareness training. And fortunately, we did see some progress, and it's up by about 15%. So we hope to get to 100% because we do see it as an easy benefit to achieve. But we're still working there to see how we can get to 100% completion on that one. And then, so that's kind of a specific example of something we've targeted, and then we're able to make a little bit of improvement there.
That's great. I'm glad that you are making progress on that and finding creative ways to get employees engaged and more involved. I think that's really important. So we'll stick with you. What role does leadership have in goal setting at your organization?
So I'll take it. So we've had a few meetings with senior leadership regarding like what our goals are for the year. And we have leadership buy-in, but it's still a challenge to continue the momentum of support for the program, just due to competing priorities. I mean, we are a nonprofit under 50 employees, and we are often stretched thin to get all of the work done that we are doing. So we really would like to continue working with leadership and to keep that momentum going, to really help us in our goal setting process so that they're really involved throughout the committee's goals.
That's great. I'm glad that you're involving leadership, and I know that can be a challenge, so stick with it. Ashley and Sherry?
Yeah, so I think we're pretty blessed in the sense that we have a very supportive executive team and senior management. So I report these metrics. I was talking about how what you see is what you get with me. So I literally bring those metrics and evaluation tools to board meetings, to senior management meetings, and we have very honest discussions about it. I think something that really works for us is role modeling what we expect. And so I think when it comes to leadership, employees need to see that your senior managers really value the program, that they're participating, that they're actively showing up. If you're doing a volunteer day on a Saturday, your exec team's showing up and they're supporting that. They're also vocalizing that support and passion for the program and the benefits to the organization during company meetings. So consistency of leadership, I think we have that. And I think that that's very, very important for a successful wellness program. I also think that having employee voices not be overshadowed by, senior leadership is important. I try very hard to, sit back and say, okay, employees, tell me what you want or what do you think's working. encourage them to tell me if they think it's a bad idea or they think I'm off my rocker, because that's what's going to help us be better leaders, and that's what's going to help our wellness program grow.
Mm-hmm. That's great. I'm glad to hear you mention having leadership members walk the talk. That's something that we talk with our organizations about a lot, and modeling that behavior. That's pretty much all the questions that I have for you right now. Thank you so much for tuning in. That was great advice and great to hear from you. Sounds like you both are doing really great things in this area. Stay tuned. We'll have questions in just a moment. I'm just going to do a quick wrap up first. So we have one more poll for you all, and I'm going to pull that up really quick. Okay, so are you ready to utilize SMART goals in your total worker health strategic planning? Yes, I'm ready to start tomorrow. No, I need a little more information, or maybe in the future. I'll give you all a minute to respond. All right, looks like it's slowing down a little bit, so I will go ahead and end the polling, share the results. So this is great. It looks like right about 2/3 of you are ready to start tomorrow. A couple of you need a little more information, and several of you are maybe in the future. So that's great feedback. All right, I'm just going to share the rest of the PowerPoint with you all. Okay, I just have a couple last recommendations and tips for those of you who feel that you're ready to start tomorrow. Just a reminder to be flexible and patient. As we just heard from our panelists, this can be time consuming, especially getting the leadership buy-in component may take some time. So just a reminder to keep at it. And then also to be inclusive. So Ashley was kind of mentioning this at the end as well, but to try to involve everyone in the organization, not necessarily just the top level leadership, but really those hard to reach employees, because we want to hear what they think as well, because they have definitely some good input into the program. All right, we'll go ahead and move into the questions portion. So I'm going to pull up some of the questions from the audience here. Okay, we have a question for our panelists. What inspired your organizations to engage in total worker health to add wellness to your values?
Well, we actually used to have a program that really, I think, incentivized employees not to take sick leave in order to gain a benefit. And in thinking that through, you know, it just didn't make sense, you know, to not use your sick leave in order to get extra vacation. So what really motivated us to get started was looking at that and feeling like that was just not how you support wellness, and from my perspective in the workplace. And a colleague of mine mentioned HealthLink. She had somehow stumbled upon this organization, and I thought this was a great way to overhaul our program and really introduce something that actually supports worker or employee health and wellness versus what was in place.
And one of the nice things about HealthLinks, which I'm sure all of you know, but I will just reiterate, is that they really meet organizations where they're at. So they are able to really provide resources and help guide us, even if we aren't to the point where we're the exemplar organization for total worker health, right? They acknowledge and assist you to achieve those goals and help you to make whichever goals you want for your organization. So that's another reason why we love partnering with HealthLinks.
Thank you. That's so nice to hear.
I think for us, it was, you know, it made good business sense too. I mean, I talked about it being the right thing to do and how it aligns with our core values, But wellness pays also. If you look at the research and statistics around total worker health, whether it's absenteeism, morale, lower depression, better mental health, greater productivity, higher engagement, the list goes on, that's all more money, that's all happier clients, that's more referrals, that's a better PR and reputation in the community. So I think sometimes we do ourselves a disservice too by not calling out the ROI and financial benefit of investing in wellness, and then also pairing that with the fact that population health and being a good steward of the community are super important.
Yeah, you're so right. And I wanted to, you led kind of right into the next question, actually. So we have a question that says, productivity and ROI are wonderful values. Beyond the right thing to do and community engagement and employee retention, do you see any cultural shift in your industry towards a culture of health?
Ooh, I love that question. Props to whoever asked that. I think for construction, I'm just going to speak. I've worked in several different industries: education, mining, construction. And so construction is really a unique animal. I mentioned that when we were doing the panel discussion, but wellness and HR are things that are not very well established in the construction industry. And in my case, I'm actually the first HR professional that my company's hired. And so I had to really manage change effectively, and then also look at not only change initiatives, but culture initiatives. Like when you're talking about wellness and changing human behaviors and how people approach the workplace and their behaviors outside of work, that's all behavior management. That's psychological. It's super complex. And on top of that, you don't want to come in and rock the boat so much that you become ineffective. And so part of the logic with the executive team and myself was, we really want to disrupt constructively how people perceive work with construction. How do you work with construction companies? What is the concept and image that's conjured up when you work with general contractors? And we felt that wellness, HR, strategic people management, which is your number one asset, right? It's what's going to make the business sustainable, are things that we need to prioritize that maybe as an industry we haven't historically done that well.
Yeah, definitely. Neha, do you have anything to add to that?
No, I don't think so.
Okay. All right. Going through the questions again. Someone asked if they could have some examples of programs you have implemented. So I know we talked briefly about that at the beginning, but maybe to dive into a couple specific examples.
Yeah. I can go first, I guess. So we mentioned the novel idea. Hopefully when we check in next year, we'll have some cool data and some positive feedback on that. But that's that educational sort of mental component. We do a lot of in-person workshops. So at first we thought, well, maybe if we do digital, right, all through like participation based, where you get wellness incentives through the portal, that would be good for our population, given that everybody's on a job site in a different location. What we found out is that our employees really wanted to have a sense of connection. So every year and once per quarter, we have an in-person workshop, and it's themed around what employees selected. So we've done some specific programming around like financial well-being. So how do you manage estate planning? How do you manage debt? We have a lot of younger people, especially in our office, and student debt and things like that are very real concerns. We've done a lot with partner organizations. So we host like blood drives, we do biometric screenings, flu shots. We actually tie wellness into both safety and benefits. So during our open enrollment period, we post our next year, our upcoming year wellness program in the open enrollment booklet. So it goes home to spouses, they see it, our employees have a chance to ask questions. And it's my kind of shameless plug to say, hey, by the way, get really excited. We have all this cool stuff coming up.
I just want to add too that part of the reasons why I chose White Construction Group was, well, first of all, that they had a wellness program, but they have a, as part of the benefit package, like a gym reimbursement incentive. And then of course, once I started, then I learned there's even more additional incentives to the program to have the opportunity to earn gift cards for participating in the wellness program.
So we have a real focus on preventative care, stuff that's individualized and self-paced for employees. And then we also built in that community sort of collaborative connection piece that employees really wanted.
That's great. Sounds like you're really taking a whole approach to wellness and tackling all of those different areas. And I love the idea to communicate with employees the way that you are. That's fantastic. All right, Neha.
So we've kind of focused on activities versus programs, just because it's a little bit more attainable for us. So one of the goals that we set up with HealthLinks was around mental health awareness and increasing that across the organization. So we actually put on an activity of a mental health awareness potluck for Mental Health Awareness Month. And so we also, again, because we have that hybrid office in DC, we were able to sponsor a lunch for that staff, because obviously it's not like they could come with their pan of food on the metro. And then we presented a presentation to them, and then it was replicated here in office as a potluck. And so we provided mental health awareness resources like the Employee Assistance Program, and then we also provided some facts and just kind of, again, working with that culture that we have in the office to kind of get people out of their offices from behind their desk and to engage with one another and feel open to maybe talking to an employee if they needed help, and just encouraging, even asking each other, hey, are you doing okay today? Because 9 times out of 10 when people ask, how are you doing, people say good, and then they walk away. But, you know, really engaging in that conversation, and I would say that the event went over very well. We had a really good response from our annual wellness program survey, so that was really nice.
That's awesome.
Yeah, that is great. I love that you're providing resources at events like that. That's a great way to do that. I think we have time for one more question. And someone is asking about, we've kind of focused a lot on wellness. So I was wondering, maybe especially for White Construction Group, how do you integrate health and safety? What are some examples of how you're doing that?
Yeah, so this past year we celebrated National Safety Week, which was kind of cool. So I partnered with our safety manager and then our wellness champions, and we put on an educational campaign around certain like high risk needs in the construction industry. So pinch points, falls, trips, tie off, all of that stuff. We held some on-site training in honor of that. We did some, group photos, really getting people involved, got some like safety week swag for people. And so the safety component is something that we're really looking to continue beefing up in 2020. We've got some specific toolbox talks that deal with substance abuse, mental health, things like that. And so for those of you who don't know what toolbox talks are, those are kind of like our weekly or daily briefings around a specific safety issue. So we started intentionally incorporating things that have wellness themes. Something that we're doing right now regarding programming, it touches on men's health. So it's Movember right now. So your last question talked about sorts of programming that we're doing. We're doing a beard contest where people get different awards for different beard categories. But the inclusivity piece is we also highlighted the voices of the women in our company. And we had them each submit a photo of the men who are important in their life and what men's health means to them. And then we entered them in a separate category to win a gift card. So it was a nice way to kind of put forth cultural inclusivity and all of these other things while also focusing on this community issue, which is men's health, right? Mm-hmm. But the safety piece of that is we also have every Friday educational components coming out around things that affect men's health. And for our population, it is safety specific. It's either, high cholesterol, high blood pressure, obesity, or it's workplace occupational stress, workplace occupational injuries. And so again, highlighting those things that are at risk for our employees.
I love that you're being so inclusive, and that's hilarious with the beard contest, but then also finding creative.
Beard anytime soon, so I don't think Sherry is either. Yeah. So we have to figure something out.
Right. Well, and involving the women, that's so creative. Anything to add from Neha?
We're a traditional office space, so we do focus on ergonomics as a safety piece, and Marissa could probably talk a little bit more about that with ADP.
Yeah, we have a payroll and benefits administrator through ADP, And they offer a workplace ergonomics assessment through our, partnership with them. So we're having a qualified individual come out and assess employee workspaces. What we're working on right now, and then we as an organization will make some decisions on what we can, unfortunately it comes down to budget, what we can afford to address. We are actually looking at relocating to a new office space in 18 months. So some of this information will help guide our efforts in what our new space looks like in terms of desks and lighting. And then now we're just working on so our remote staff work from home. They only have a shared office space on Fridays. So how do we get them the information they need and to make their home workspaces more ergonomic? So that's where we're at right now, and that's really our biggest safety concern, in addition to like cords and things like that, is how people are holding their bodies and their workspaces.
And mental health is tied to all of that as well, especially with them being remote staff. I mean, that's inside, four walls you're looking at. So, it's work-life balance, stresses with work, all of those things. Those are definitely some points for us to consider as we continue trying to reach goals and set goals.
All right, well, I think that is all of our time. Thank you so much to the panelists for being here. That was fantastic. And thank you all for attending. I did just want to let you know that I will be following up with an email, and in the email I will have a link to this video if you want to go back and watch it or refer to something. Information about the continuing education credits if you're interested in that. And a new thing we're starting is doing a one-pager to accompany our webinars. So I'll include that as well, just for an easy tool for you to look back and remember what we talked about at this webinar, and hopefully utilize that in your organizations. Did want to announce that our webinar series will be relaunching in January 2020. So stay tuned for announcements about that. And thank you again so much. Have a great day.
Thank you.
Thank you.
Thank you.